I just want to, an incredible film, really, really remarkable, and deserves to be seen by a lot of people. So I hope that this is a successful enterprise for you. I guess this is the first time it's being shown. I hope it's shown a lot more to a lot more people. What's your experience, your background in making documentary films? How many have you made so far?
I would say around 20. In my career, over 25 or 30 years.
Okay, and this is the most recent one? Yes. Okay,
yes.
And how long did it take you to make it?
It was about 2 to 3 years. It was harder because of COVID.
Yeah.
So we started and then we needed to go back. And I had the odd experience of actually directing remotely, which I've never done in my life before. But we had to because we couldn't get on a plane, so our cinematographer field produced some of a couple segments near the end. We were able to finish the film.
Okay, so what put you onto this film? Out of all the films you made in your career, what put you onto this topic and this film?
I'll have to thank Jenniphr can talk about this too, but Jenniphr, our executive producer, it was her idea. We were out for dinner one night and she had read an article called "What Bullets Do to Bodies" by Jason Fagone, and we just started talking about it. Jenniphr is a director-producer too. We thought we've reached that point in our careers where we wanted to make movies that might make an impact rather than just entertain. And you might want to say anything more on it?
Well, a series of Parkland had just happened, and I think we all felt so helpless and powerless. And reading that article and sharing it with Jody, and she thought this could be a good documentary, and off we went and trying to raise money. And Jody had some wonderful connections that helped us move forward with Dr. Teperman and Dr. Romo. So it's been a journey, and we're so honored to have them here and honored to be here. Thank you for having us.
Oh, absolutely. It's our honor, absolutely. But so you had these contacts before with these doctors before you started to make the film, or did you get the contacts as you made the film?
It took us to get through all the HIPAA regulations to get into the hospitals these days is really difficult. So
I was going to say the access must have been incredible.
It took about a year for us to get through friends of friends and family who know people, and then we had to have, we had attorneys work with the hospital's attorneys. So it took quite a bit of time, but ultimately we were successful, and we were put in touch with these fantastic physicians who really deserve all the credit. And we're happy to be able to shine a light on their work because it's incredible.
And did you start with going to Jacoby? Did you say that we want to go to the places where there is the most gun violence? So we're going to go to the Bronx, we're going to go to Philadelphia,
Yes.
we're going to go to Baltimore. That's
Yes.
what we know we want to do.
Yes.
Right.
Well, Dr. Amy Goldberg was profiled in this article that Jenniphr saw.
Okay.
What Bullets Do to Bodies. So
Right.
we started there, and then we worked our way out to Jacoby and then Baltimore.
Okay, so just for the doctors for a second, given the importance of getting this issue out into the public, did you try to make it easier for them to have access because you wanted them to have the access so we could show that they could show the story?
So, there's the old adage, you can't fight City Hall. Imagine if the City Hall you're trying to fight is New York City Hall. So Jody had worked in the Obama administration, and there was someone down at City Hall that she knew well. And he had, I'm not telling any stories.
No, my husband, I didn't work in the Obama administration. My husband did.
Right. Well, she was just telling us a story at breakfast that she spent a fair amount of time with her child in the White House when she couldn't see her husband. So, the city had said, yes, you can film inside the hospital. Then they said, no. Then we got to say yes and then no. And actually, in the end, some of what you see is a simulation because the rules have become so complicated about actually filming real patients. But to your point, it was very important to me that this story be told correctly, and you had to see what the docs were going through. In fact, two of my partners, my wonderful, so the one thing that comes through for me in this story is I work with some really good people. I mean, Amy Goldberg and Joe Saccharin, who I know just a little bit, they have such good souls. And so too, Hodge Reddy and Alex Guerre, trauma surgeons, gentlemen. They have, it is such an honor to be in this profession. But to your question, the story had to be told correctly through our eyes, and that could only be done inside the hospital.
Okay, so from a filmmaking standpoint, back to the film for a second, getting the access, just incredible to have that access, much more effective, obviously, and the simulations, also the dramatization of things like Dr. Saccharin's wound and reliving that and so forth. So the dramatizations, the simulations of the simulation teams and so forth, all go to making it the story more effective, I think. But I wanted to ask, from a medical perspective, the stay in your lane situation, which seemed very powerful, and was there such a stupid thing that the NRA said, but that doesn't seem to make any difference how stupid they could be. But what the response to that, he said, was viral in the beginning, and I saw a lot of great responses. Was there an NRA response, and has that continued?
So just to move backwards on that, so why this whole thing is so relevant to me, although they do a very good job in the movie, showing you the inside of me. But so I had been on the board of New Yorkers Against Gun Violence for the better part of 2 decades. So the NRA thing I was very familiar with. So I started, in the late 90s, and at a certain point, when I had done some, I was on CBS, national CBS, on one or another of these initiatives, and for a week, my secretary, this is 15 years ago, my secretary had to be walked out to the parking lot because of the threats we were getting with armed guards. So it didn't surprise me. It wouldn't surprise me now if someone in the audience got up and started, some conspiratorial rant. That's happened to me many, many, many times at panels like this. So, and what you do such a, it's the first time I've seen the movie, would you do such a beautiful job, and our wonderful editor, I keep joking with her that she did a great job making me look skinny. What there can be no doubt after you watch this movie is whose lane it is, right? And what Amy says, and my partner James is here, and I touched his knee because he knows this is true, is that the thing that will drive me out of this business and early to retirement is the death telling to the moms. It just, each time it takes a little bit of your soul. But, so Dr. Romo, so they tell the story, the Sadie Mitchell thing, which I didn't realize was that's always hard for me to see, and that's absolutely true, the way in the beginning of the story, the way it goes, and it was sort of an inflection point for me that what we were doing wasn't working, which is why I started to think about the SUV program, and I'm very, very grateful that we found someone as awesome as Dr. Romo, who was really the person to be heading up the program. Noe?
Yeah, please.
I think This Is Our Lane really kind of took a life on its own, and I think it brought a lot more of the physician perspective to how gun violence impacts our daily lives and our daily jobs. So much so that at some of the major pediatric conferences, it was actually a lot of sessions called This Is Our Lane, just based on improving that community advocacy treatment to trauma patients, and how, as pediatricians, as physicians in general, we need to be better about being more involved in this active role, because it is indeed our lane, as Dr. Teperman said. And also, I think the movie did a fantastic job in not just exemplifying how it impacts us as physicians, but communities and families. I was not expecting to see, that was real, that actually happened though, the 4 hours after that musical, that actually happened, and we talked about it, how we couldn't have, obviously we didn't want that to happen, but it happened, and we had really gone 183 days without a shooting until that double homicide. And it was traumatizing for the team, because these are all young men, but I'm glad you were able to capture that moment and that mother's response and that grandmother's response, because that's often what is not seen. when we talk about gun violence.
Well, I think that's a large part of the power of the movie was your ability to get to those scenes and get that honest, immediate response. And it shows that, it seems to show that if there's anything going to get done about any of this, it's going to happen at that level, which is tragic, and yet the one positive thing we have, which is that at the community level where the impact is the greatest, in the hospitals where the impact is the greatest, is the only way to seems to be able to respond to it. I mean, the mention of Sandy Hook, when Amy talks about Sandy Hook, and I remember shortly after that there was an article in a paper in the UK, I guess, that said that one thing that Sandy Hook proved was that in the US it's okay to kill children, which is, what kind of a reflection is that on our society?
Yeah, so if I may, so you know how, if you were alive when Kennedy was shot, you know where you were and that kind of thing. So I can tell you exactly where I was at the moment I heard about Sandy Hook. I was on the way to the operating room, and it was President Obama talking about, just addressing the nation, talking about it. And I have to say, having been a gun violence advocate for, all these decades, that I looked at him and I thought to myself, nothing's going to change. And just to dovetail with that, there's a picture of me in 2003 in the United States Senate, the Russell office building, the press conference, trying to get reauthorized the assault weapons ban. And I'm with, McCarthy, Congresswoman McCarthy, and one of the Kennedys. And I am at a podium standing behind the AR-15. So that's the gun that was used as Sandy Hook. So I'm there, tilting at windmills, really, trying to get the Senate to reauthorize this thing. And then it's me looking at Obama, and then it's 15 years later, and that same gun was used to mow down those children.
Yeah. Well, and then Columbine and Parkland and the rest of them. And when they got to the economic argument, which is one that I have often tried to stress and see if that's a way to get traction. And I think about the economics, they talk about the economic burden, right? And so if on the one hand, the pro-gun source can be traced to wanting to make more money, and then, well, okay, so what's the economic impact on the other side? And I looked it up again recently because I still can't believe it, but there were 411 gunshot wounds in Las Vegas. So 58 dead in the initial shooting, 61 total, but 411 gunshot victims. And each one of those being, just from an economic standpoint, forget the dreams lost, the trauma for the rest of their lives. As you saw, the survivors of gun violence are not doing that much better than the people that died in a lot of ways. And their families are impacted in an economic way that's phenomenal.
Yeah.
And yet, nobody talks about that. I don't know. Is there any way to get traction on that economic argument?
So that's actually, when we talk about the number, they mentioned a number there. Now the number is closer to 350 billion a year. And I think the majority of that cost is not like medical costs. The majority of that cost is what we call lost productivity. And lost productivity is, you see the young men in the film who are paralyzed, for example, or people who are incarcerated as a consequence of this, or people who have mental health issues chronically because of what happens, who are not able to fulfill their careers or even get a job, or most importantly, people that die. They don't get to get a job or be productive members of society, and they don't get to pass that on to their own children or their own family members. A lot of these family members live in households where multiple people have to work to make ends meet. So when one person is lost, it's a significant source of income that is lost, which has significant downstream effects, multi-generational effects actually. So the majority of the cost of violence is lost productivity. It's not just medical costs, and it stems far beyond the actual medical costs.
Which are phenomenal in their own right. And also, what other things could doctors be doing if they didn't have to spend that much time and effort and energy and soul energy in terms of informing the parents?
I have a funny story to tell about that. I was on the steps of City Hall, it's got to be 15, 20 years ago, tilting at windmills on this topic, and a obscure cable news reporter came up to me. We'd just done some press conference, and said to me, "Hey, Dr. Teperman, would happen to you. You know, how would you make a living if you were actually successful in stamping out gun violence? And it's kind of an absurd question, and I turned to them and I said, you know, I used to be pretty good at taking out gallbladders and appendixes. I think I'll go back to doing that.
Well, I wish that you could. That would be excellent. So, where does it go from here? Your program is showing so much, and it demonstrating there are 60 some odd emerging or existing and emerging programs in intervention with gun violence across the country. That's a movement that started, and are you involved in sort of helping people to build new programs like
Yeah,
that?
so unfortunately, the violence has increased post-COVID, as we have seen in our own trauma center. Our numbers are up close to 175%.
Really?
Post-COVID in terms of number of gunshot wounds. We are seeing New York City on its own is up 55% with shootings and homicides compared to where we were pre-COVID. So the numbers have definitely increased since the COVID pandemic, which has led to a renewed interest in a lot of these violence prevention programs. Former Governor Cuomo, before he left, declared a state of emergency in terms of violence and allocated a lot of funding towards programs. Mayor de Blasio did the same. So I guess unfortunately, we're having this conversation earlier about our program and expansion. There's the need for us to expand, so we're expanding out to other neighborhoods in the city. We're expanding the number of services we provide within the hospital. We've got an additional close to $1 million from the city to expand our program to other sites, and another $900,000 from the state to expand the number of services that we provide to our trauma patients, including further psychiatric care, more support services, more social work services, because I think what we're finding is that we need to kind of expand our reach and think beyond just the individual patients and focus more on how we can help their recovery, help them, for example, get jobs, get better job training, get better housing, and the psychological effects, the trauma effects, the PTSD we are seeing needs to be treated along with other underlying psychiatric conditions that they have, and we just simply didn't have the resources to do so.
But to amplify, Dr. Romo is very humble. Dr. Romo, in June, did a press conference with our Congresswoman Alexandria Octavia-Cortez and Chuck Schumer. They came to Jacoby to praise the program, and they put, I think the number is $5 billion into the Build Back America program, citing Dr. Romo's work and the work at Jacoby and work like it, the kind of thing. And what AOC said at that press conference is that it's about the communities, and in particular, we take pride because, you know, Jacoby's New York City Health and Hospitals, right? So it's the largest public hospital system in the nation. And what she ends the press conference by saying is, we need more of this. We need the public hospital system, and we need more of this work in the communities.
Yeah.
So what is happening now in New York State is there's a movement to try to kind of replicate the model we have at Jacoby through other trauma centers throughout the state. And Governor Hochul has allocated some money through the Department of Criminal Justice, which helps fund us. And we're intricately involved in trying to see what we can do and allocate different resources to figure out what we can do statewide and also citywide within the health and hospital system. Other trauma centers are interested in having some type of violence prevention initiatives given the increase in violence that we have had.
But one last thing, though, I don't know if it's the last thing, but with my anti-gun violence advocacy hat and my 2 decades, working with New Yorkers Against Gun Violence, it is the guns, right? You know, so it's youth, it's poverty, and it's guns. If you take the guns, and I'm not saying no one should have a gun, but if you take the bad guns out of the equation, you have no gunshots. So just because, no one wants to talk about it, and I'm sure we can talk about it here, right? So 40% of gun transfers in the United States of America happen without a background check. And the vast majority of card-carrying NRA members say that shouldn't be. You should undergo a background. This is low-hanging fruit. You should undergo a background check if you're going to have a gun. You should, there should be safety training when you have a gun in the home. There should be so what happened in Michigan last week. There should be child access prevention laws. And there should be no assault weapons, right? No, even like the most ardent, gun advocate will tell you, really, we could do something about assault weapons. So, the work, and it was that moment with Sadie Mitchell for me that eventually engendered the fact that we needed to go into our communities. But we should not forget the fact that we do have this folie à deux, which is, this collective insanity in the United States about the guns. There is something we can do together as a society. We don't have to take the gun out of everybody's hands, but just those three things, and with Dr. Romo's help, we can go a long way to solving this problem. It's not an insolvable problem.
No, I think that the solutions are in front of us. The question is getting them engaged, and I think that magnificent work to get that extra support, and it's really hard to parse how much more needs to go into the trauma centers and how much more needs to go into the community work, because the community work, if the guns are going to exist, which they are, because the second-hand gun in some of those communities, it's not somebody that's going to a gun store to get their gun, they're getting it from somebody else. So, and the illicit gun trade, and now we have the phantom guns, the ghost guns. So, but if the guns are going to exist, which they probably are, and not necessarily the assault weapons or anything else, but it's going to have to be educating or changing the community vibe on that. And that was just really inspirational to see the work that they were doing. And to your credit, the way that you were able to film that, and which is not necessarily a community that wants to be filmed in that way. So that was real courage on their part and yours. So can you talk a little bit about when you were filming that, how that was going? Were you able to be on site for some of that? I saw a lot of masks that were hanging on the
Yes,
subject.
we were on site for most of it. For us, it was both a heartbreaking film to make and an inspiring film to make, because, it's heartbreaking to see what's happening to these young kids, but it was inspiring what these physicians, the trauma surgeons and Dr. Romo and his group are doing, and they are having a significant impact. So it's a very complicated problem, and, I don't presume to know the answers, but I do think that Dr. Teperman is right. I mean, it's so easy to get a gun right now. And working with Dr. Romo's group, walking through the streets of the Bronx, we asked one of them, how difficult would it be for you to get a gun right now? And they said, just pick up a phone and we could have one in an hour. So it was just sobering to hear that. I guess we knew that on some level, but, So in the end, we hope that this film gets a broad distribution and can shine a light on some of the great work that they're doing, which is why we made it.
As I say, back before I was asking, has there been an NRA response to the It Is Our Lane? Or has there been no response?
Not that I know of. Do you know of?
Well, so there was, with Joe, there was a back and forth for quite some time. I mean, if you ever...
Well, Joe was getting death threats.
Yeah.
Still is. I mean, he gets letters taped on his car.
But you hit on it, so having been at them and with them, and it's about the money, right? So it's a 10, it's a 12, it's a $20 billion industry. And as I've had these conversations and arguments with them, directly, online, in their face, the more you threaten their bottom line, the more intense they threaten you back, bodily harm or whatever. It's a one-to-one proposition. It clearly is about the money that this generates for the gun lobby.
Well, it's not an intractable problem, but it's a very difficult problem, and I really hope that are you going to festivals? Are you campaigning this film in some ways?
Yeah,
so.
and then this is our premiere with you all. You're the first to see it.
I know. I'm so happy for that. So happy for that. I'm just sorry there aren't more people here to see it.
Yeah, we'll go to a few other festivals, and then we're hoping to go to distribution.
Okay.
And I don't know what that will look like. It might be PBS. It might be streaming, Amazon or Netflix.
Well, I
But
hope
we're
it's
just starting the
PBS.
journey, so tell your friends.
Yeah, absolutely. So does the film have a website?
Yes.
It does.
It's
and that
GSWthefilm.com.
And does that website go to Dr. Romo's programs and other things? I mean, or are there ways?
Yes, yeah. It will eventually.
Okay, so that's good. So good luck to you all. And
Well, thank you. Thank you for having
Let me
us.
see, first of all, if anybody here has any questions that we want to get. Okay, right here.
Very well done. I have a question for the filmmaker. What was the most surprising thing that you sort of discovered throughout this journey for this film?
That's a good question. I'll start. The most surprising thing to me was learning that 80% of the gunshot victims survive, in part thanks to these level 1 trauma centers and doctors like Dr. Teperman. That was for me.
Well, I think I was naive on many different levels, but I had no awareness whatsoever that so many people survived and were paralyzed. I think that was really deeply disturbing and shocking to me. So,
And just to
Yeah.
follow up, if I may, and so we had a conversation about the paralysis thing, but what I remarked about to myself is the beautiful job you did with it. So in this advocacy, so everybody likes to talk about I said 33, it's now 40,000 gun deaths in America, it's going up. But nobody talks about this because it's just too horrible. And I think, I was talking with Alex this morning, but Dr. Reddy, who's the second in command, is doing such a beautiful job at the trauma center. When we came back from the first surge, the first COVID surge, and by the way, Dr. Reddy, me and Dr. Guerra ran 6 COVID surgical intensive care units taking care of COVID patients exclusively. We sort of put the trauma thing on hold. But when we came back from it and the gun violence increase that Dr. Romo was just discussing, there was one after the other, after the other, after the other, after the other in our surgical intensive care units. Young black men paralyzed. And we know what that looks like. I mean, you did such a beautiful job. I've never seen anybody do the job of describing what that looks like. The young man who's no longer a young man, the photographer. I mean, that was just so beautifully done in his life. And look, it also does talk to the resilience of the human spirit. I mean, if you think about it, that he could come back from that and do the work that he's doing. But that is so not understood in America, with the devastation of that injury and how common they are. It's just a whole nother sad part of it.
And it's just, it ripples out and ripples out. But again, the inspirational part is that, and there should not be a need for this, but that there's a support group for paralyzed victims of gun violence. So how sad is that, and yet how good is that that's being provided? Because, and there was a brief mention in there in the film of the PTSD, which is, and Dr. Romo just talked about it, but the ramifications just keep going and keep going. So, magnificent job. Any other questions right here?
Yeah, along those lines. In the movie, there was, I can't remember whether it was a doctor or a mother or something who was talking about how if they could show the pictures of these slaughtered children, like a little graphic detail, what we see and what we've just seen recently in this shooting, pictures of 4 beautiful, alive and well children. Right. And she was making the point that maybe this would make a difference. And that would be a pretty severe thing to do on television, but do you have any sense of whether that would make a difference or if it's even possible?
It's interesting because I work with a lot of the community, and all of our outreach workers tell me the same thing when we're working in the hospital. They say, Doc, if people could see out in the community what happens in here, they would understand the impact, because these outreach workers are there with me seeing the patients when they're injured in the ICU or when they die, when we're telling the parents, and they deal with the aftermath and they deal with consoling the parents. And a lot of the people who are shooting the community don't know this. They don't understand that ripple effect, right? You shoot into a crowd, you leave. You don't realize what the impact that had. Dr. Teperman mentioned the the impact of paralysis. We just had last month a 17-year-old young man who was shot by a stray bullet while just playing basketball. He was not a gang member. He was shot in the neck, and he's paralyzed from the neck down for the rest of his life. This was a young man who had a scholarship to play basketball at a major university starting next fall. So that just gives you a sense, and we were with this young man day in and day out, and our outreach workers were with him day in and day out. And the people who are shooting and they pick up that gun don't see this. So I think there needs to be, and this movie will do a great job at that, at putting a face to the violence and putting a sense of what the ripple effect actually is, because I think a lot of our young men and women out on the streets who are performing these acts don't quite understand the true impact. And I do think that there needs to be more of an understanding of that.
Right here.
Well, thank you for that, and we will do that. Thank you.
You know, I do like your comment though, and the young man, not so young man, the photographer, what was his name? Jaleel. He says, he speaks to what you're talking about. He says, you know, what about, I was just a kid. What about, see, I was listening. What about my rights? So, you know, the Second Amendment, right? A militia being necessary for security of free state, the right of people to keep and bear arms shall not be abridged, right? So there's a whole complexity to that, a whole 110 years of jurisprudence on it. And even the Supreme Court, you know, in Heller versus DC, where they did turn some of this back, said that reasonable gun safety laws are just that. They're reasonable and they're constitutional. So there is work that can be done, and you're so right. We do have a right. Your kids, our kids, have a right to walk down the street. Sadie Mitchell had a right to be in her bedroom watching TV without a spare bullet come through. What about our rights to live?
Yeah, that's it. Jackie?
Yeah, last question. Pretty basic. I think what's so stunning about the film is to get to see what one bullet can do to a body. But what happens to your body in that kind of an assault does. So if you're doing any kind of impact campaign, I sure would include that. Make a 30-second spot. As horrible as you can.
Well, that's a great idea.
Make it as horrible as you can. Well, this is a horribly beautiful film, so thank you so much. And thanks for bringing it out here and letting us see it
Thanks
first.
for having us.
And I hope a million people see it.